I'm Mandy Anderson. Today I'm going to show you how to do a head-to-toe complete physical assessment. First, we're going to start off with your equipment. The first thing you need is a blood pressure cuff, you need a thermometer, stethoscope, pulse oximetry, you need your pen light. This is a Rosenbaum or a visual acuity chart, a tongue depressor, a Q-tip or a cotton tip applicator, reflex hammer, something to smell. This is alcohol, and we need our otoscope with our plastic applicators as well. Okay, so that's our equipment that we're going to need, and then I'm going to get started. Okay. Of course, I'm going to wash my hands first. I'm going to foam in, foam out, one of those, and I'm going to walk in and say, "Hi, how are you?" Good. My name's Mandy. I'm going to be your nurse. Can you tell me your name and date of birth?
Sure. I'm Tisha Ward, and my birthday's 1/31/88.
Okay. So I'm going to start off doing vital signs. Okay. So 2 patient identifiers. Okay. Is there any reason I can't take it in this arm?
No.
And what does your blood pressure normally run?
Usually like upper 120s over 80.
Okay.
I'm nervous, a little higher.
So I'll palpate the brachial here, and then go ahead and put my stethoscope down. Uncross their legs if they were crossed. Got 136 over 84. Not bad. So what brings you in today?
Just been having headaches, sinus pressure, drainage.
Okay. So you have pain? Do you have pain right now?
Not right now, but I've been having headaches.
On a scale of 0 to 10, which 10 being the worst pain, what would you rate it?
Probably about a 4.
97.8. Probably a 4. Okay. I'm going to get her pulse ox real quick. Are you coughing or anything?
No.
No production, no wheezing, shortness of breath.
No.
So she's about 98 is the pulse, 87%. I mean 87 pulse and 98% pulse ox. Okay. I'm gonna go ahead and take your pulse as well. So does the pain radiate anywhere?
No, it's just throbbing, constant.
Okay. And what makes it better?
Medicine.
What do you take?
Um,
Does something bring them on? Are you doing something when you have them, or is it just the
I think
weather?
it's just the pressure.
We will let him know. So can you tell me where you are today?
I'm at Howard College.
I'm gonna write those down, and I would write those down. So you're at Howard College, can you tell me the year?
It's 2016.
Okay, so alert and oriented to person, she's alert, she's awake, that's her level of consciousness, she knows where she is, she knows who she is, and where she is at, and if I asked her the president's name, she could tell me that as well. So that's alert and orientation. Glasgow Coma Scale, eye opening, 4, 5, 1 through 4, so her eyes open spontaneously, so if she has a 4 there, her motor response, she can follow commands, she's moving fine, so a 5, and then her verbal, because she's speaking normally, she's responding appropriately, so that would be a 6, so I would give her a 15. Okay? And of course, height and weight, I would ask her her height. I could measure her height over here on the scale and take her weight as well. And then calculate the BMI, which you'll do on your patient. Okay? I'm going to start off with cranial nerves, because that's just my routine, so I'm going to do that. The first one is olfactory, cranial nerve 1. If you'll close your eyes and close one nostril and tell me what you smell. Okay, so cranial nerve 1, intact, patient able to smell alcohol. Okay, can you read this chart for me, Miss Ward? Clever one, I,
Oh.
and tell me the smallest one that you can read.
4, 2, 6, 7, 8, 9.
Okay. 2020. Okay, now cover the other eye. I couldn't read that. And tell me to do the same.
4, 2, 6, 7, 8, 9.
Okay, if you have a Snellen chart, you can use the Snellen chart. You can use these, Rosenbaum. These you hold about 14 inches away. So she has 20/20 vision. That's cranial nerve 2, optic, visual acuity. Okay, 3, 4, and 6 we test together. That's the ocular motor, the abducens, and the what? The trochlear. Yes. All right. So we have ocular motor does pupil reaction, and eye movements are in and out. Abducens does the lateral eye movements. Okay. So at first I would dim the lights. I'm going to check her pupils. I'm going to shine the light here. Okay. On your pin light, there's always a gauge. It tells you how many millimeters, so you can see what they are before. Shine the light. Shine the light. They both should constrict equally and should be the same size. Okay? Miss Ward, I'm going to have you follow my pen. Just don't move your head. Just follow with your eyes. Okay, up. Down. And then our lateral. That goes too
Cross
far.
eye.
Yeah. So ocular, EOMs, extraocular eye movements are intact, and that's 3, 4, and 6. So those are intact. 5 is trigeminal, which is a mixed. It's motor and sensory. So I'm going to go ahead and palpate the jaw, open and clench your teeth. Good. We're palpating that mandible joint, feeling for anything weird, strange there, or crackling, rubbing. And then I'm going to have her close her eyes. And if you can just tell me if this is a soft or sharp feeling, okay?
Sharp. Soft. Soft. Sharp. Soft.
Okay. So her facial sensation is intact, and then they're both intact because she can, the motor as well. Okay, number 7 is facial. If you'll puff your cheeks for me, smile, and raise your eyebrows. Good, so facial is intact, number 7. 8 is auditory, vestibular, cochlear, whichever one you say. We're going to do the whisper test. I'm going to walk behind her, and you stand about 2 foot behind the person. She's going to close the opposite ear on the tragus, this little part right here. She's going to close that, and I'm going to whisper 3 things to her. Okay? Ready?
A64.
I was trying to say it so they can see it. And then we're going to switch to the other ear.
238.
Okay, so her hearing's intact. She can hear me whispering. Okay, 9 and 10. We'll also check together. That's the glossopharyngeal and the vagus. Okay, they're both mixed, motor and sensory. So we're going to watch the uvula rise when they say ah. They're going to have, it's okay. Also the vagus does gag reflex. 9 does gag reflex, and then vagus is also swallowing. They're talking, all those things. So I'm going to have her open her mouth and shine the light, say ah, and then I would stick that back there and make sure she gags, okay? And then you're swallowing and talking okay, no problems there. Okay, number 11 is the spinal accessory. Shrug your shoulders, and then turn your face against my hand. And that just means she can go against resistance. So 11 is intact. And then number 12 is hypoglossal. Stick your tongue out and move it side to side. Good. There's no rolling, there's no shaking of the tongue, so those are intact. Okay? All right. So we got those out of the way. All right, then I'm going to go back to her nose and ears and eyes. I'm going to start with the head, okay? The head is normocephalic. Her hair is shiny. It's pretty. Her skin, I'm always looking at. It's a nice pinkish tan for her. It's warm. It's dry. It's not moist or anything. So I'm going to look up the nose, okay? Because she's congested anyway. I'm looking at those turbinates. Open your mouth. Say ah. We look at the teeth. We would grade the tonsils if they were enlarged. And then we want to look at her ears as well. On the otoscope, you put the plastic applicator on and turn it here to the left. And then pull the pinna of the ear back on an adult so you can visualize the ear canal and the tympanic membrane. And it should be pearly and white and gray. Okay, pearly white and kind of a shiny. She has some blood in her canal from yesterday. We were messing with it. Okay. All right. Then we're going to palpate her lymph nodes. I'm just putting some notes there. Okay. Any tenderness here? A little bit. A little sore. I'm just feeling for anything that's enlarged, nodular. And then on the thyroid, we're just going to palpate. You can do anterior or posterior approach. Take the 2 finger pads here, right there, and feel the thyroid. You're just making sure there's not any goiters or enlargements there. And take a swallow for me. Okay. All right. While I'm back here, I'm just going to go ahead and do my respiratory assessment. Okay. I'm going to look at her respiratory effort. It's even. It's non-labored. She's resting comfortably. Even if I wanted to check out the spine, I could at this point. Okay. So I've inspected and palpated. I'm going to do a chest expansion here. So I place my thumbs here, pointing together on the costovertebral angle. Take a deep breath. And my thumb should spread out equally. So that means she has equal expansion on both lungs. Okay. When I percuss, I'm just going to stay in between the 2 scapula bones here inside the intercostal spaces. And it's a 1-2 strike, down 3, across 4. It's always a side-to-side comparison. Okay. While I'm back here, I'll just auscultate. And I use the diaphragm of my stethoscope. Deep breath. 1, down, 2, down 3, and then 4, 5, and then 6, and then 7. And then I'm going to kind of come over here under the maxillary 9 to get the lower lobes. Yeah. Okay. I'm going to come to the front, because I always do posterior and anterior. So these are our tracheal sounds here. Deep breath. Really, I should start over here, but. Okay. And then 2. 3, 4. You might have had something in there. Did I rock that? And then I'm going to come under here, under the mid-axillary. Now I'm just going to go ahead and listen to her heart. Okay, I'm going to start here. This is my aortic. I'm using the diaphragm. If I was worried about a murmur, I could turn it over and listen with the bell, because those are going to be a lower pitch. Okay, so my aortic. And just tell them to breathe normal at this point. And then my pulmonic. Erb's point. Tricuspid, and then our mitral. Okay. I'm also, this is the mitral area, but this is also the apex of the heart, which is the point. We call it PMI, point of maximal impulse, or apical area. You can palpate that. You may or may not feel it, but you want to make sure if you do, there's no thrills or heaves or anything like that. and I don't feel anything abnormal on her. I'm always gonna check cap refill here too with cardiovascular. Cap refill's less than 2-3 seconds. Skin is good color, it's pink. I would also check my pulses. Here's my radial. Gosh, I'm sorry. My radial. And then I could check my brachials here. Carotid, if I check those, just don't do them at the same time. Palpate, you grade each pulse. 1+, 2+, 3+. Okay? And then I'm gonna auscultate her carotids. If she'll just take a breath and hold it. And I'm just listening for, now take it and let it out again. And I'm just listening for a bruit there. Okay, make sure there's no occlusion of those arteries. Also, I check jugular vein distension. You can do it sitting up. Sometimes it's better when they're in the supine position because you can really see them distend at that point. Okay. Then I could check my popliteal pulses or post anterior tibial inside, and then always pedal as well. Okay, her legs are warm to dry. There's no discoloration. Her skin, her feet are cold, but that would be probably normally with the room temperature. Hair growth is normal.
Sorry.
So
She's sorry, you can tell.
You're fine. So go ahead and lay back. Now again, if I wanted to check jugular vein distension here, I could see if those jugular veins were popping out, but I don't see anything on her, which is good. Abdomen, remember the order is different, so we would inspect contour, symmetry, center of the umbilicus, make sure there's nothing protruding, herniating, striae may be present. Then you're gonna auscultate second. Okay, start in the right lower quadrant. And you just hear some movement, gurgling, peristalsis type activity. Then you go to the right upper quadrant, left upper quadrant, and then the left lower quadrant. Okay, so then I can palpate. I start with light palpation, which is about 1 to 2 centimeters with my fingers here. And you're just feeling around for anything that is abnormal mass-wise or herniation, anything that causes tenderness. And then I could go into deep palpation, which is about 4 to 5 centimeters in depth. Okay, no pain, no tenderness, rebound tenderness, nothing like that. Okay. Then I'm going to percuss. I'm going to put my finger here and start striking it on the abdomen. It should be a tympanic sound. Okay. No problems there. If you'll sit up for me, I'm going to come over here and test for costovertebral angle tenderness. Okay, so again, on this angle here where the ribs end, I'm going to go ahead and percuss. I'm going to cut my hand and tap. Does that cause you any pain? Okay, and that doesn't cause any pain either. So this is the flank area. We're checking the kidneys back here for any tenderness or anything there. Okay. Alright, so I'm now going to check her musculoskeletal range of motion. Okay, so I'm going to inspect and palpate joints. Alright, have her lift up her arm straight. Good, and out to the side. There you go, and I don't feel any crepitus or creaking or anything like that. I'm going to grab another upper extremity and do the same on the elbow. Okay. I could also do the wrist if I needed to. Can have them do a fist to see if that causes any pain there. Want me to do a fist? No. Okay. Legs, as far as hips, you can also do the knees, ankles, hips. On the knee, go ahead and do the extension here. Okay, and then you could have them raise it up if nothing of that causes pain or joint problems. Okay, you can also do this while they're lying in bed. Okay, the ankle, palpate that joint. Go ahead and flex and point, and then go around. she has a little bit of popping in that. Do the same here. Flex, point. Alright. And I'm going to have you hold your hands up like here. Pull against my hands. Good. Squeeze my fingers. She's got good muscle strength. Push against my hands. Okay. And pull back. Alright, so her muscles are good and have equal strength bilaterally. Okay, so then we're going to check some reflexes and do our neurological, okay? So we're going to start with the brachial. It's the, bicep. I'm sorry, it's the bicep. So I would have my patient lay her arm here, and I'm going to go ahead and press my thumb down on that tendon there on the bicep, have them relax. There you go. And then the arm will pull this way or flex the bicep up. Okay? Tricep, right here where this funny bone is, everybody knows where that in between the top of the elbow. Relax your shoulder. There you go. Have you hold the weight, okay? And then the arm flexes outward. The brachial radialis is right here along this radial vein, and it pulls the thumb up typically. They really should there it goes, a little bit relaxed. Okay, then you have to compare the other side. Always have to do the opposite hand. Okay, relax. Okay, that, good. And then the brachial radialis here. Then we're going to go down to the patellar. Okay. She has a little one there. In between that patellar bone. The Achilles. Alright, you're going to hold the foot, relax your leg. You're going to hold the foot up slightly and tap behind. Relax. There you go. And the foot will point downward. Yours are not that responsive on your Achilles.
I can feel it though.
You do. Babinski, I can do this lying down as well. Take not a sharp end, but something that's a little more dull, and strike it up towards the toes of the foot, and the toes should curl on an adult. Okay, they should not fan. If they fan, that's an abnormal, and that would be a positive Babinski. Okay. All right, I'm going to have you stand up for me. Okay, I'm going to have you take about 10 to 20 steps that direction. And then come back towards me, heel to toe. Good. This is assessing possible coordination as well. Now I'm going to do the Romberg. Okay, I'm going to have her stand together with her feet real close. Close your eyes. You're going to stand next to them so that in case they start swaying and want to fall, you're here to catch them. Okay. Normally they sway a little bit anyway, but if they start to widen their base or start to fall, they could be a neurological problem, cerebellar. Okay. Go ahead and hop on one foot, and then turn now the other, and then slightly bend. She's able to maintain position. Yeah, you can come out. Okay. All right, so that's a negative Romberg. If it was positive, she would have lost her balance, or she would have widened her base and all those things. Okay. I think that is it. We've done that. This, I hope, helps you complete head to toe. Is there anything? Oh, edema. One of my students said edema. Yes, during the cardiovascular, I would check for edema or swelling in any location, lower leg extremities, when I was checking the pulses. Okay. Thank y'all. Hope this helps.